Okay, antidepressants. This is a very controversial topic because all antidepressants have a black box warning. The black box warning for antidepressants is you have to be careful because when children are started, as children, adults, are started on antidepressants, suicidal ideation may increase. Okay? The important thing there is that once you start, when the black box warning came out, the amount of frequency and the amount of antidepressant prescriptions started going down. And then the suicide rate seemed to go up. Now, they're still trying to figure out time-wise if one did lead to the other. But what we do know clearly is in the studies, suicide attempts and suicide do not go up with the treatment with antidepressants. Suicidal ideation, which is the thought and the verbal expression of suicide, does go up. Now, when you have a depressed adolescent in the office and no one has asked them, we always have to ask, that's part of the interview, have you ever thought of killing yourself? And they say, well, yeah, I've thought of doing this. There it is, there's the suicidal ideation, right? If they are guarded, they will not tell this to anyone. They won't say it to their teachers, they won't say it to their parents, they won't. Then they're started on antidepressants, they're less anxious, they're less guarded. What are they going to do? They're going to say, they're going to answer the question truthfully, and they're going to say, yeah, I've been thinking about this maybe for the past 2 years. Not necessarily because the medication was started, okay? That being said, if you start an antidepressant in a child that has bipolar disorder, okay, and this is another difficulty, bipolar disorder usually presents, right, as a depressive episode before any hypomanic or manic episode, right? So usually when they have a depressive episode, they are diagnosed major depressive disorder. And how do you treat major depressive disorder? With an antidepressant, right? You start the antidepressant, they're really not MDD, major depressive disorder, they're bipolar disorder. It just has not presented itself, and they start revving up. They start becoming more aggressive. They start having more energy. They're not sleeping now, and now you have mixed episodes or hypomania or manic. And then they got diagnosed bipolar disorder, and you take them off the antidepressant, right? So that is something that can occur with the antidepressants. Now I'm going to go back because I just went on with a whole bunch of detail, jumped ahead of time. But the indication for the antidepressants, major depressive disorder or anxiety disorders, okay? You can treat the depression of bipolar disorder with antidepressants, but you need a foundation of mood stabilizers before that, and we will talk about the mood stabilizers. So when you hear bipolar disorder, that doesn't mean antidepressants are contraindicated. It's just the way you set the layers of medication up that change. We have different types of antidepressants. We have the tricyclics. They're the older type of antidepressants. They're good antidepressants. They can have some significant side effects, though. Amongst the problems with tricyclics is that you can't overdose, and it is fatal, right? That's why the SSRIs, like the Prozac and Paxil and all those that we'll talk about in a little bit, became also so popular because the safety profile is much better, right? On tricyclics, again, if you have someone that's depressed, they're thinking of hurting themselves, they're planning suicide, they plan on overdosing, they can overdose on tricyclics. So that's why in kids, we don't like to use tricyclics too much. The parent has the responsibility of also having these medications locked up, and that's not always the case with all the parents. They don't always have the medications locked up. So if someone accidentally gets into a tricyclic, you know, like kids, you know, the vitamin thing, they want to take their vitamins, then the little ones, they don't know what they're taking, then they can overdose on them. And again, it is fatal. So we have also the SSRIs. The SSRIs, the Prozac, Paxil, Zoloft, Lexapro, Celexa, these are the common happy pills, right? And the kids will use that term, the happy makes a physician decide on one medication over the other medication? Well, although most of these work on the serotonin system, they have different levels of time that they stay in the bloodstream, right? Different levels or different speeds of metabolism. Some kick in faster than others. For example, Lexapro, Celexa might be medications that you see even at 2 weeks of starting the medication, some level of effect, okay? Other medications, for example, Prozac is a good antidepressant, but what we use it in kind of general terms, it's kind of a dirty medication, because if that medication needs to be used in a person that has medical problems, it might interact with all the other meds, right? So drug-drug interaction is also something that we need to consider. And for example, in this list, Prozac would be the one that interacts the most with other meds compared to Lexapro and Celexa, which is a medication, an antidepressant that is more commonly used in individuals that have multiple medical problems and have a list of other medications they have to take. Because again, the drug-drug interaction is less. Paxil, even though it's indicated in children, is a medication like Effexor that is very difficult to wean off of. And so in kids, it's a little bit more difficult to do that, so we try to stay away at this point from that medication, from the paroxetine. But the Prozac, the Zoloft, the Lexapro, and the Celexa are still used. And there are others that are starting to come up on the market also. Other side effects of these medications: headache, stomach ache, and I just do not want to swallow the pill problem. Not all of these, most of these come in, the brand name come in capsules, and it's difficult to get the kiddos to take the capsule, and not all can be opened up and sprinkled. Okay, we talked about the Wellbutrin. The Wellbutrin use in ADHD is a non-stimulant. Well, it's also an antidepressant. It's a medication that does not at all help with anxiety. So if the person has depression and anxiety, or depression and panic attacks, Wellbutrin is probably not the medication to use, because it makes the anxiety increase, or it can make the anxiety increase. So then you have a person that maybe is not so depressed, but very, very anxious. And it can give that feeling of anxiety also. Then we have the mixed antidepressants, like duloxetine, which work on the serotonin and the norepinephrine. We have, for example, Cymbalta is a newer medication on the market. It's an antidepressant. It's not only serotonin, it's a mixed antidepressant. With that medication, it's the one that you hear advertised because it decreases pain as well. Well, that's true, but the other antidepressants do the same also when it comes to that. Pain and depression come hand in hand. So pain increases depression, depression increases pain. So when you treat the depression, you can improve some of the pain symptoms. So that's something that can happen with any of the antidepressants. How do you determine dosage? Well, in kids, you always start, it doesn't matter how old they are. They can be 15, they can be 5 years old. You start at the lowest dose possible. You check for side effects first. If they need a medication follow-up within 2 weeks. If there is not a medication follow-up within 2 weeks, there's a red flag there, because you need to check for the side effects mainly with these medications. And so, and then you start adjusting for the dose. One thing that I usually do when you, or a question that I usually ask is, when you try to follow up or when you try to inquire about the family psychiatric history, it's important to inquire also about the treatment, if known, that other family members have responded to. Because usually that medication is what's going to work on the kids. So mom responded to Lexapro, then we're going to give Lexapro a first-line chance in that child, because usually the genetic makeup kind of gives you an idea of how they're going to be, who they're going to respond to, or what medication they're going to respond Risks and side effects, we already talked about the suicidal ideation in kids and antidepressants. So again, they need to be followed up closely for the increase in suicidal ideation. The parents need to be able to ask these questions also and feel comfortable with addressing them. Okay? And not always, and being careful and not saying, oh, you're thinking this way because the medication's making you think this way. The child stops the medication, the depression worsens, and then you have suicide attempts. So yeah, again, it's very important to inform the parents and help the parents in communicating with the child when it comes to suicidal ideation. Now, neuroleptics or antipsychotics. What is psychosis? Psychosis is auditory hallucinations, hearing voices, seeing things, visual hallucinations, okay? We also have olfactory hallucinations, bad smells, right? Usually those are seizures, but they can be part of psychosis as well, okay? So, tactile hallucinations, any of the senses can be abnormal perceptions of the senses, and they can be hallucinations related to psychosis. Okay? When we talk about this type of psychosis that is treated with these medications, it could be psychosis induced because of not so much mental health issues, but also other issues. For example, lead poisoning can lead to psychosis, right? And it will respond partially to antipsychotics, but it's not going to completely go away, and you're not treating the problem until you treat the lead poisoning. Okay? So it's very important to identify the psychosis and the origin of it, because if it's another medical problem like epilepsy or seizure disorder, lead poisoning, increased copper or calcium deposits, brain tumor, then you need to identify those things and not cover them up with the medications, right? Because they will partially respond. Alcohol withdrawal can cause hallucinations. It is treated with an antipsychotic, but that can be fatal, so you need to be able to identify that as well. Okay? So, what are the indications, the psychotic disorder? Among also the psychotic symptoms, besides the hallucinations, we have delusional thinking, right? Paranoia, it's a perception, ideas that just kind of stick, and there's nothing you can do to change that idea. It's just a constant fixed idea. Paranoia when they feel like people are looking at them constantly, or the individual might feel like someone's trying to hurt them. The FBI is trying to chase them down. Those kind of things. They're not perceiving in like auditory or visual hallucinations, but they have these fixed ideas that it does not matter how much you try to convince them otherwise, it's not going to change. Okay? So that's delusional thinking. That's also psychotic thinking. In kids, antipsychotics can also be used in kind of bizarre behavior. When we talk about bizarre behavior, when you think about it, if a parent says to a child, no, you cannot use the television or watch television, and they just completely lose it, just full-blown temper tantrum, start punching walls, you kind of think there's really not a good reality testing there, right? The response, the aggressive response to that trigger is very severe, and so there isn't a very good connection with reality at that point, right? So antipsychotics are also and can be used in aggression. Mood stabilization. In bipolar disorder or to stabilize mood in general, we have the antipsychotics, and we also have the medications that later on we'll talk about, which are the seizure medications that are used in bipolar. So sometimes you will see the antipsychotics used in individuals that are not psychotic, but they're aggressive or their moods are unstable. In autism, the antipsychotics are also used. For example, the Risperdal. Again, because there is some lack of reality testing, but what you're trying to treat is not the autism. Antipsychotics are not to treat autism. It does not cure autism, but it can help with the aggressive components if the child has aggression, right? Or mood swings. because of the lack of perceiving the surroundings correctly. Okay, so again, it's used in autism. It's actually indicated in aggression in aggression in autism, but it does not cure autism. It does not help the child interact better with their peers unless they're interacting better because they're not as aggressive. Okay, types. Risperdal, we have olanzapine, quetiapine, which is Seroquel, the Geodon, and the Abilify. These are in order of from kind of the oldest to the newest ones. And we also have Invega, which is a form of Risperdal, but it's a long-acting. They come in injections. They come in pills. They come, some are long-term medications. In other words, they're depot shots. They can be used. They're injected. They last for a week to help, especially with the non-compliant individuals. If you're paranoid and you think that all these pills have poison in them, then you're going to have a compliance issue. So the depot presentations, the Risperdal depot or the Haldol, which I didn't put up here, those are medications that can be used. Usually the depot medications are not used in children until you are completely sure how they're going to respond to the medications, because you don't want to have that lack of control. If they have side effects, what are you going to, you have to wait it out, right? So you want to make sure that you use the shorter acting ones, okay? Risperdal is used in young children, 4 or 5-year-olds, especially if there's aggression. Okay, what are the limiting factors with the antipsychotics? The limiting factors with the antipsychotics are mainly the potential side effects. We have multiple side effects that can occur. The most talked about, let's say, one is the metabolic syndrome. The metabolic syndrome with antipsychotics is the metabolism is changed in the body such that the person is predisposed or can present the signs and symptoms of diabetes, right? Or their metabolism slows down, so they increase in weight and they become obese. These are some of the most severe side effects that can occur, and they're more long-term side effects. Okay? The antipsychotics, especially Zyprexa, even Risperdal, can cause an increase in appetite. And that then contributes to the metabolic syndrome because you already have a decrease in metabolism and metabolic rate, and then on top of that, they're eating, right? Unfortunately, the craving is for carbohydrates, usually not for vegetables. You know, kids don't get started on Zyprexa and start eating salads. They eat sweets. If they're bipolar, right, they already have a craving for high carbohydrates, and then you add this, and it's a significant problem, okay? And then you talk about peer interaction. Well, if you were kind of a skinny guy, and then you go, you know, you're on medications for 3 months during the summer, and then you go back to school and you're chunky, you're going to get teased. So that's another consideration. So all these social interactions we also have to take into account when the kids start having side effects because of medication. Antipsychotics can also lower the seizure threshold. So if a child has seizures that have not presented, similar to the Wellbutrin, then the seizures can present eventually. Or if they have a seizure disorder, they're on seizure medications. This is a tough one to kind of deal with. But you need to use an antipsychotic. You have to work very closely with the neurologist because it can bring the seizures out. They might need an adjustment in their seizure medications to control the seizures. Other side effects, something we call EPS. The way it presents is muscle stiffness. There have been, I see some kids that they're kind of in the legal system, right? And unfortunately, one of the most important things you have to do when you're dealing with medications in kids is you have to have very close follow-up, because it's very difficult to determine when the side effects are going to present. And the kids don't always know what they have to say. You know, they don't understand what muscle stiffness is. You know, a parent, an adult is going to say, oh, I have this pain here, like someone in our audience already has right now. But the child doesn't, they don't say those things. They don't say, I feel stiff here, I need a massage, kind of thing. They're 5 years old. But you can start seeing them. They move a little bit stiffer, right? Their walk changes, a little bit more shuffled. Those are side effects from the antipsychotic. Does it mean you have to stop the antipsychotic in a child? Possibly, but you definitely have to treat the side effect if you're not going to stop it. So that's when other medications like Benadryl and Cogentin come in. We'll leave those for another talk. That's a whole different topic. Other potential side effects. There can be cardiac side effects, basically in cardiac rhythm. So Geodon, you definitely want to get an EKG when kids are on Geodon because there can be changes on the EKG, and you have to pay attention to those changes because of, again, they can be fatal. They're not going to necessarily have heart attacks, but what they can present with is arrhythmias, and their heart is not beating the way it's supposed to beat, okay? So that affects circulation, and that affects many other things, like blood to the head. So those are the main side effects of the antipsychotics. Dosage, again, dosage depends on the tolerance and the effectiveness, so you always start low. That's the story with kids. Always start low, and then you start moving up on it. So if the child is severely psychotic, do you start on very high? No, because if they start getting side effects, what use is the medication? They're going to stop them, right? So you always start low with kids. What are the expected results with antipsychotics? If you're hallucinating, the expected result is to not hallucinate. Okay, it's straightforward. Is that always the case? No, because sometimes there's a child that's diagnosed with schizophrenia, and fortunately it's not very often when the younger ones are, because they don't present so early, or it's not as common in early, just in general, then they will have or can continue to have some level of auditory hallucinations, for example. And they kind of they get used to it. You will hear them saying, well, this voice was telling me to do horrible things, to hurt this other person. As the medication starts kicking in, they'll hear maybe mumbling. And they learn through therapy, right, to kind of deal and cope with the mumbling, to not pay attention to it. So that you're limited by the potential side effects and the dosage of the medication, so that they learn to deal with some level of their symptoms. And that happens often in, for example, schizophrenia or schizoaffective disorder. And we already talked about the risks and side effects of these medications, potentially.